Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, our guests include Lynn Moore, president of the Novant Health Ostomy Support Group. We'll also meet Dr. Michael Schultz, Assistant Dean for Extramural Clinical Practices at East Carolina University School of Dental Medicine, and he'll speak to us about a new dental clinic in Brunswick County. And finally, we'll talk with Christy Williamson and Victoria Bellamy about the 2016 Brunswick Beacon Health Expo. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest is Lynn Moore, president of the Novant Health Ostomy Support Group. Welcome to our show today, Lynn. It's a pleasure to have you here.
Thank you. I'm glad to be here.
Great. Now, I understand that you're leading a new support group at Novant Health, and I'd like to learn more about that today. Can you share with us?
Well, sure. I'm a retired teacher, which you'll be able to tell from the way that I talk, who lives on Ocean Isle Beach. I currently volunteer at the Museum of Coastal Carolina, and I love to line dance and fossil hunt, and I happen to be an ostomate.
An ostomate, is that what it's called?
It is.
Okay.
That's what we consider ourselves. So we are folks who have had some kind of diversion, some kind of surgically created opening that collects waste, and that can be urine or it can be fecal matter. That's collected in a nice little pouch and disposed of.
And that's an ostomy. That's known as an ostomy?
That's
Is that correct? Well, that's pretty interesting. What would the purpose of this support group be, Lynn?
Sometimes people choose to have this type of surgery done. Perhaps they've been chronically ill for a year with Crohn's disease or diverticulitis, something like that. And this is such a relief to get rid of a lot of the pain and symptoms of those conditions. Other times it's done for some kind of emergency, and a person wakes up in the hospital and says, oh my goodness, I've had this surgery, now what do I do? So there are various ways that one ends up in this condition, but nevertheless, here you are. The home health nurses will say, here's the equipment you need, best of luck, and you're on your own. Brunswick County does not have any place available where folks can go to figure out about how to live their lives as normal people again.
So it's obvious there's a great need for something such as an ostomy support group in Brunswick County. I'm curious, who can attend these meetings?
We're looking for folks who might be considering having such a surgery.
Oh, really?
Folks who are in the hospital waiting for surgery or have just had the procedure done. We're also looking for folks who've been ostomates for many years and can come and give suggestions and encouragement and say, look, I play tennis, I travel, I fly on airplanes, I've gotten married, I've had a baby. All the kinds of things that we want folks to know that normal people do. And just because you have an ostomy does not mean that you can't be part of the regular normal world.
Well, would caregivers be invited to the support group and along with family?
We would love to have a husband or wife or your partner, because it's important for those folks to know what you're going through as well. Yes. We're even encouraging anyone who's in the field, such as student nurses, who need to know and would like to know more about, yes, you can read in a book what an ostomy is, but you'd like to talk to somebody who's been through it and wears it on her body or his body every day.
Now, you said that you would talk about methods of ways to use it, different things like that, but what are some of the other topics that might be considered at the support group? Would you have speakers?
We would. We can bring in a local physician who would talk about issues such as hernias. A large portion of ostomates will develop hernias over our lifetimes, and so we need to know what to do about that. We have representatives from the three main manufacturers who come in and show us new products, how to better deal with the daily ostomy needs. We also have authors who've written books about why me or here's my new life. And we have one in Wilmington who's going to come and speak to our group.
Oh, that's great.
And tell us about his journey and then share his book with us.
In terms of the products that you use, are they readily available in this area, or do you find it difficult sometimes to find the products you need?
Most everything has to be ordered through catalog. So you have to have vendors available. You have to know who the folks are and what products they have. And the way to do that is to come to something like a support group and let us lay out on the table, here's what we've got, here are the new things. Would you like to try some samples and take some things home? That's where you get the knowledge, because you don't have it available at a counter at the drugstore.
Yeah, I was curious as to whether you had to order them on the internet or if you could go to your local pharmacy and get these things.
Right,
because
things
that
are
could
ordered.
And something always happens. You run out of your last bags. Somehow it gets past you, and you might need them.
Right, and you are in big trouble.
That's what I
because
thought.
you can't run up to Walgreens and just say, I
Really?
need a box. No, there's such a variety of the products available, so many sizes, so many types, open-ended and closed-ended, all types of varieties. So they don't stock it. You have to order. You can get emergency order. Sometimes they'll deliver overnight for a fee, but it's something you have to be very aware of.
Would it be part of the support group's bailiwick to visit patients in the hospital? Would there be a time when you might sit with the patient to explain to them what it's going to be like when you go home?
Absolutely. The things that I can do are share my personal story. I cannot give medical advice.
No, of course
because,
not.
Right, I'm not a nurse.
No.
But I can say, these are some tricks that worked for me. Here's what brought me comfort. Here's what I did first. Here's how I got up the courage to go out to dinner.
Oh, yeah.
The first time.
Yeah.
Because I was worried. So, yes, we have to be certified through the hospital.
Of course.
As a volunteer. And so each
great.
one that wants to do that goes through that process, but
Right.
that's fine.
How often are you going to meet?
We're going to have our meetings the last Sunday afternoon of each month.
Okay.
So it'll be at the hospital from 2 to 3:30. We hope folks will have their morning activities finished, but Sunday afternoon is a pretty good time for most folks. And since we're inviting the many members of the family to come,
Right.
you can come as an outing. And so that would be the fourth Sunday from 2 to 3:30 at the hospital. We'll be in the first floor conference room.
Can you share with our viewers when the next meeting will be?
February 28th is the fourth Sunday of February.
So it's always the fourth Sunday, not necessarily the last Sunday.
Correct.
The fourth Sunday.
Once in a while, that will conflict with a holiday and we'll bump 1 week earlier.
Okay.
But basically, it's the fourth. We also have contact information, and I think
Okay.
that will be available through Novant and possibly through this program.
Yeah, I wanted to ask if somebody out there watching is interested in joining, how might they do that?
You can contact me, and I have a web address that is ostomyforme53 at gmail.com.
Okay.
So I set that up. Anyone that wants information.
And I suppose that they might call the hospital too to get further
Our wound
details.
ostomy nurse is Danae Cook-Blanks. She's an RN and a wound ostomy nurse. And she also has her email at the hospital, dcblanks@novanthealth.org.
Great. Well, thank you so much for coming today. It's been a pleasure to have you, and I look forward to hearing how it goes.
Thank you so much.
You're welcome. Our next guest is Dr. Michael Schultz, Assistant Dean for Extramural Clinical Practices at East Carolina University's School of Dental Medicine, and also he's the Director of Community Dental Practices and an Associate Professor. Welcome to our show today, Dr. Schultz. It's a pleasure to have you here.
Well, thank you for having me.
You're quite welcome. Now, you have a long title, you have lots of roles, so I want you to tell me what you really do at East Carolina University.
Well, I was recruited to come down to East Carolina to be the director of what we call the Community Service Learning Centers. And my other title is Assistant Dean for Extramural Clinical Practices. And I have had the opportunity to oversee the construction, the equipping, the staffing, and the operation of our community service learning centers, of which we have 7 in operation now, and the one here in Brunswick County will be number 8.
And it's a beautiful building. It's fabulous, and I'm so excited for it to open. Let's talk a little bit more about the services that you might offer at this learning center.
Okay, the services, the mission of our clinic is, of course, education. And so we are educating general dentists. And so the clinic will offer a full array of general dentistry, but will include some specialty type of procedures as well, such as implants and root canals and extractions and all kinds of prosthetics as well. So it's the full array of dentistry, but under the umbrella of a general dentistry type of clinic.
Now, when you say full services, they'll do cleanings?
They'll do, yes, just everything that you could possibly get done in a private dental office, and will serve all populations, from children to geriatrics. Yes, ma'am.
So, who actually does the dental work? Are they students?
Well, the way we have the clinic set up is that we have 4th-year dental students who will be providing care.
Okay.
Additionally, we have postgraduate, what we call advanced education in general dentistry residents, 2 of which will be living in the area for a year. And so they have already completed dental school. They'll be providing care. And then also our faculty dentists will be available to provide care too. So it's actually 3 different levels that will be able to provide care.
That sounds awesome.
Yeah.
How many days a week do you anticipate to be open?
We'll be open 5 days a week,
Okay.
from 8 until 5, Monday through Friday.
8 until 5. And who else will be working at the clinic other than the dentist? Will you have other?
Right. Well, it's, as I said, it's based upon a private practice type of platform. So we'll have front desk personnel.
Okay.
We'll have dental assistants. We'll have hygienists. We have a business manager that runs the business side of the operation, in addition to the faculty dentists.
Now, the 4th-year students, when they finish their rotation, is it a year? Is that what they?
Well, they're 4th-year students, and what we do is have them serve 3 8-week rotations at 3 different locations at our service learning centers across the state. So Brunswick will serve as one of 8 areas where our 4th-year students will love to be able to come down here to serve 8 weeks.
At the beach.
That's right.
And so every 8 weeks there may be a change.
Yes, there will be. But as I said, in addition to that, we'll have the advanced education in general dentistry postdoctoral residents who will be here, who are already licensed as full dentists. They'll be providing care, and the faculty dentists will be providing care as well.
And you call these community service learning centers.
That's right.
Is there a philosophy behind why?
Well, yes, there is. As I said, the mission of the clinic is to provide dental services, but also it serves as an educational platform for our students and our residents who are completing not only their clinical requirements, but they're providing care to the patients that come in. So we call them learning centers because a lot of what's going on there is education. And the education works 2 ways. It works for the students and the residents, but also we're here to educate the general population about the importance of oral health.
Yeah, and that is an important thing here. And in Brunswick County, I think there's a lack of dental care.
Right.
Not the resources are here, but folks often either can't afford it,
right,
or just for some reason don't get it. And so I'm curious about the structure, the financial piece. Are there criteria that have to be met in order to be a patient?
No criteria whatsoever. We accept any patients who are full pay, full insurance patients, all the way down to people that might be eligible for Medicaid or health choice types of patients. So anybody that comes in the door, we make a good attempt to be able to treat.
And would there be someone there that might help them with that process? Because that's a hard...
Oh, absolutely.
To navigate that, it's difficult.
Yes, we do. We have front desk personnel that are going to be well trained in that, and then our business manager is there as well. Now, you asked about the fees. Our basic fee is at about 68% of the usual and customary fee that somebody would pay if they were going to a private dentist. So there's about a 32% discount because they are being treated in an educational situation.
Really?
Yes.
That's interesting.
Now, we'll also have some reduced fees for people that qualify. If they're at 150% of the federal poverty guideline or below, we'll cut that down to 50% for them.
That's awesome.
Yeah.
So someone who has dental insurance, say,
Right.
can also receive services there, and then you would bill their insurance company, or would
Yes,
we be...
we accept any dental insurance. We also accept PPOs. There's a number of PPOs that we're involved with, and the front desk personnel will take care of all of the insurance matters for all of the patients that come in.
I'm curious why you chose Brunswick County. Was there a method to that?
Well, each of our service learning centers are selected according to certain criteria, and one of the main things we look at is not necessarily the locality in which it's placed, but also what we're doing is taking a regional approach. And it's not only the needs in Brunswick County, but also there's a lot of need in Columbus County, Pender County, and Bladen County.
True.
So we're hoping, and our experience has proven, that each of our service learning centers, we have about a 4 or 5 county impact on the patients that we serve.
Yeah.
So we look at, in locating them, we really look at the number of Medicaid patients that are eligible. We look at the number of Medicaid patients that are enrolled, and then also we look at what we call the penetration of Medicaid, which means that how many people that are eligible for Medicaid are actually receiving services. So that's the main criteria that we base our location on.
Let's talk about making appointments. How does that happen?
All folks have to do is either drop by the clinic or they can call the clinic, and the phone number is 910-253-9000, and that phone will be in operation in probably about a week from now because the telephone folks have to come by and hook up all the phones still.
And when do you anticipate opening?
We anticipate opening towards the end of February, 1st of March.
Well, that sounds good. Now, I know that being close to the hospital, there's going to be a lot of interaction between the hospital folks and you all. Do you have any big plans for an opening, a grand opening,
yes,
or ribbon cutting?
Yeah, we will certainly have a ribbon cutting up in April. I believe the date is April 18th.
Oh, good.
And it will be a big event where everybody in the entire area is going to be invited to that. Mainly because there have been a lot of stakeholders in us coming here, and so county government and public health and the hospital and other folks. A lot of people in Brunswick County have really been responsible for us locating here. So we want to thank them, and then also we want to have a big kind of opening party for everyone too.
Yeah, I know that the emergency department will be really happy to have you.
Yes.
Because oftentimes that's their local dentist.
Right.
You know,
right. And that's one of the things that we do in every area we go to. We develop a direct referral system from the emergency department over to our clinic to take that dental load off of the emergency department. So that's one of the things that we'll be doing with the Novant Hospital there is helping them in that area.
That's really going to be a real help to them. How about networking with local physicians? Do you anticipate going out and meeting with physician offices?
Yes, we do that in every location that we're located. We network as much as possible, with public health, social services, local physicians, whomever we can that might be referring patients to us. In addition to that, at each location we have an advisory board made up of members from the community, and we'll have folks that are in the education area. We'll have social services, we'll have business people, we'll have faith-based persons, and we have a board usually made up of about 8 people. And what they do is they provide us the region in which we're located. Hopefully we get good feedback from them. But then also, we really want to have community outreach projects for our students and our residents. So we ask them to help facilitate us getting our students and residents out in the area to do community service type projects.
Oh, I love that community service aspect of it.
Yeah.
I think that's a great way to reach out to the community. Do you have a website?
Yes, we do. You can just Google East Carolina University School of Dental Medicine, and it'll come right up.
We have a lot of East Carolina folks in this area.
Yes,
in fact, several physicians have graduated from the medical school there.
That's right.
And we really enjoy having them around. So.
Yeah.
It's been a pleasure to have you here.
Well, thank you
so much. Great job.
Yeah.
I look forward to the opening, and we'll see you soon.
Okay, thank you.
Our last guests today are Christy Williamson and Victoria Bellamy, here to talk to us about the 2016 Brunswick Beacon Health Expo. Welcome to the show today, Victoria and Christy. It's a pleasure to have you guys back.
Thank you.
You're always, every time you come, you tell us some exciting stuff. So I can't wait to hear what's coming up. Now, Victoria, I know that you work at Novant Health Brunswick Medical Center. So tell us what your role is at the hospital.
That's correct. I am the Community Engagement Specialist at Novant Health Brunswick Medical Center. So I help to plan and coordinate community relations programs for the hospital and for our physician practices. I also support the foundation. So I support our foundation board. I help with our foundation events and programs that we do for our employees and out in the community with the foundation also.
So you help with all those fun things
Yes.
we have.
Fun job.
Yeah. How about you, Christy? Tell me about yourself for our viewers who don't know you. I know most people out there do know you, but let's talk about who Christy is and what she does.
I have a fun job too. I have been at the Brunswick Beacon for almost 16 years.
Wow.
Long time. But I am an advertising representative and also our special events coordinator. Oh. So we do 3 shows throughout the year, and I manage an account list, so I go out and meet lots of people and get to spend lots of fun time with
your clients?
With my clients every day.
Yeah. You both have similar kind of jobs in that respect. You're out in the public, so
Enjoy
to
it.
speak. Yeah. Well, today we wanted to talk, to start off, talking about the Brunswick Beacon Health Expo. So, Christy, tell me where it is and what the date is.
This is the 10th year, so happy anniversary to the Health Expo.
Happy anniversary to the Beacon Health Fair.
But it is going to be at Charlotte Middle School again this year, and it's on February 27th, 9 a.m. to 2 p.m. So we're trying to make sure that there's a good range of time for everybody to be there. That is a Saturday, so hopefully that everyone can come out and enjoy all the things that are being offered.
And speaking of that, let's talk a little bit about what is going to be offered.
Well, we have lots going on that day. Of course, Novant is our premier sponsor. So,
and we're happy to be there.
And we love having you there, and you guys always do such a wonderful job of coming and presenting and showing off all the things that you can do out there. But we also have the American Red Cross that is coming out to do a blood drive.
Oh, good.
The Animal Protective Services are bringing out the pets again for pet adoptions.
Oh, that was cool. That was good last year.
Yeah.
And the Lions Club is actually bringing out their mobile unit to do vision screenings this year. So we're really excited. That's an ad for this year.
Yeah.
So we haven't had the mobile unit for the screenings before, but thank you to the Lions Club for sponsoring that. But we always have all the screenings that we do all day are all free.
Yep.
So, it's a really good opportunity to come and kind of see where you are and, find out more about providers to get more information about the results that you get for all the screenings there.
I think the mobile mammography unit is going to be there again this year. Is that right?
That's correct.
Yeah. So that'll be, that's another good thing that we can offer to the community.
Yes.
So real excited about that. Well, let's talk about who can attend this event.
Everyone, it is open to the public. It is free. There's no admission to get in. As I said, everything there is free, including the admission. So, and we have something to offer for all ages.
How about kids?
Absolutely, and we also offer free child care there. So
You do?
We do.
I didn't know that.
We have child care that will be available so that when parents come in and they want to go get some of the screenings, or if they want to go give blood,
Wow.
then we do have supervised child care so they can drop off their kids and go and spend the time that they need to do to make sure their screenings are taken care of.
And let's do the times one more time. Does it start at 9?
9 o'clock.
9?
We're there at 9 a.m. and it will be over at 2 p.m.
2 p.m. Okay, good deal. Well, Victoria, I heard that Novant Health is participating in this event once again this year. And as Christy said, they are the premier sponsor. So tell me a little bit more about that. How long has Novant been participating in this?
I believe we've participated all 10 years, is that correct, Christy?
Every year.
So we've continued to be the presenting premier sponsor. We really enjoy being involved in this event. So Novant Health will have lots to offer at this event. We'll have information on our hospital departments, our emergency departments, surgical services, women's services, things like that that are in our hospital. We will also have a lot of information from our physician practices, both our primary care physicians and our specialty offices. We will offer screenings, and we will also have our mobile mammography coach, as you mentioned.
Yeah. Let's talk about that mobile mammography unit. Will they be doing mammograms?
They will. They will be taking appointments, and we recommend going ahead and doing that appointment as soon as possible. But we have a great mobile mammography coach, has state-of-the-art digital mammography, wonderful female technologists that work on the coach, just really great women that make you feel comfortable.
Right.
And it's just a really great service. We have the mobile mammography coach a few times every month. We share it with our sister facility, Novant Health Rowan Medical Center. So we're lucky that we will be able to have it again this year at the Health Expo.
Now, will it be there on campus at the Charlotte Middle School? And hopefully it'll be conveniently placed for folks to access it.
Yeah.
So that's great. I'm excited about that. Tell me a little bit about financial assistance for mobile mammography.
Okay. Well, our foundation was really fortunate to be able to receive a grant from the Susan G. Komen Triangle to the Coast affiliate this year, which is wonderful because that gave us funds to be able to do screenings. So, of course, when people come or whenever they make their appointments, they will, if they meet a certain financial criteria, they may be able to have help from those funds, which would cover the cost of the mammogram. Otherwise, if you have insurance, our technologists can file it accordingly that way.
That's great. So if they have insurance, how might they, can they file the insurance, or how does that work?
Yep, they can do it all right there on the coach. It's a really easy process.
So, and the paperwork for the financial assistance, is that done right on the coach?
It is.
Also?
The technologists will be able to help you with all of those pieces of information as well.
And tell me again about appointments. Do they make them through the hospital?
Yes, our radiology department. So folks can call the radiology department. Their number is 910-721-1485. And they'll be able to just let the person know that they want to attend the February 27th Health Expo, and they'll be able to see what times are available and get them into one of those time slots.
Okay. That sounds great, and you do recommend appointments, so
yes,
that way you'll be assured of getting your mammo that day.
The screenings take anywhere from 15 to 20 minutes, so you want to make sure you go ahead and get that appointment. That way it doesn't fill up too fast.
Well, Christy, before we wrap up, would you tell us again where it's being held and what time, and that it's free?
It is free, free admission, Charlotte Middle School, February 27th, 9 a.m. to 2 p.m. The one other thing I did want to mention is that we do have the medication disposal drop-off. So please bring in all over-the-counter or prescription medications. They are dropped off and will be disposed of properly. No questions asked. We just take care of it.
And the Sheriff's Department will be there to collect those?
Absolutely.
Great. That's a great thing.
February 27th, Charlotte Middle School. Look forward to seeing everyone there.
Great. Well, thanks, guys. Thanks for coming. It's always a pleasure to have you. And I hope you have a great turnout.
Thank you very much.
You're welcome. Thanks for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, please visit novanthealth.org. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.